So I have a friend who's a psychiatrist, and it's 1979, and he calls me up and he says, I want to go hear this guy, Wilfred Bion. He says, Bion. I said, yeah, I heard that name. He writes books about analysis that are like mathematics, and I had, like calculus, and I had trouble in 7th grade math. And I don't know anything about analysis, and I have no interest in it anyways. But I don't know why, there was this sense of excitement in me. And I said, all right, I'll go. And not only did I get to hear Bion, but I got to hear 4 other analysts who were top people in town. Now, having worked with Erickson for a couple of years before, and having gained an access to my unconscious, and one of the things Erickson said was I could use the hypnosis as much as I needed to. See, and I was a type A personality, so I used it 10 hours a day. Which all sorts of strange things started to happen with energy, with sensory perception. And I was about as fine-tuned as I've ever been in my life the night I went to hear Bion. So the first man presents about Bion's work. And he says, Bion, of course, worked with thinking disorders. And the man gives a presentation. I feel such pain on the sides of my head that I thought, oh, the patient would have to cure himself in spite of the analyst. And then a second analyst, a very brilliant man, just absolutely brilliant, asks a question to Bion that's 5 minutes long. And he's aggressing toward Bion when he says it. Bion said that the difference, he didn't say it at that point, but he always said the difference between an officer and an enlisted man was that an officer could think and respond in the line of fire. Bion was a tank commander in World War I in the British Army. Well, there's this 5-minute long question comes at him, and Bion is like a block of granite. As solid an object as I've ever seen in my life. Doesn't smile, no social courtesy, and he says, perhaps you can expand upon the subject. The question was 5 minutes long. And the man looks back and looks fearful, and he does expand on it. He asked the question even longer. And Bion says, well, I'm afraid you've asked the wrong member of the panel. Perhaps you can expand upon the question and ask someone who's more appropriate to answer it. Which the man does. Now, finally Bion began to talk, and he said, with all that's been said about me, I can hardly wait to hear what I'm going to say. And Bion was noted for having thoughts without thinking, having a hookup with preconceptions, half-truths, and a way of saying things where the physiological experience was as if someone was so pure in their level of being, so simple and so pure, it felt like somebody had a bicycle pump and they were pumping up my body, and Jesus, I could breathe again, my head was clear. It was just an awesome experience being in his presence. With this ESP I told you I had developed.
You have developed?
Beyond went on for an hour and a half, and I only got one slight twitch on the side of my head, and I thought, wow, that's as close to perfect as I'm ever going to see. And at the end of that evening, I was one of the last people in the audience, and I said, Beon was walking on. I said, geez, Dr. Beon, I said, it was a pleasure just to be in the audience. He said, it was like a warm bath massaging my mind. He says, well, I enjoyed myself very much, and I make it a point to do what I enjoy doing. But he had a way, and I'm not sure I really had portrayed that for you in a way that you could experience it, but he had a way of saying it. We almost felt like the man was so in tune with your unconscious that he had to be in your skin to make that kind of a statement. The next thought I had was, I ought to write this man a check for a session. My God, he said one thing to me, and he's hit this central struggle in my life. And I just looked at him sort of dumbfounded. And I knew we had more to say to each other, but it wasn't then. Well, subsequently, my practice is now psychoanalytically oriented, although I do see hypnotic work and couples and families and supervision, but primarily psychoanalytic work. In the way I understood, Beyond practiced it, as would come through who Len Bergantino is. I see it's just about 12:30. I did say that I was informed that the meetings break at 12:30, but I did say that if the climate were one that was interesting to the participants, I would be willing to stay till 1 if the group were interested, and perhaps do a demonstration of the kind of work I'm talking about. At this point you have a frame of reference of where I've been, but that kind of experience itself is a bit different. So I don't know what the group would like to do at this point.
I'm willing to stay till 1. I want to say to you, whenever I hear you, Len, I have such a strong reaction to it that I find it hard to sit. I feel gypped. I feel as though we were promised an experiential workshop. I think that's what you said. And it's very pleasant to sit around and hear stories about what a great therapist you are and how well you've trained, but I feel gypped right now.
So from your point of view, then this wasn't an experience.
I'll have to think about it, because I'm surprised. No, I didn't say that, because it was an experience. But I'll have to give it some time to evaluate, because I find myself angry at it. So it was certainly an experience.
I wonder if when things aren't presented in a usual fashion, that perhaps you have an expectation of some sort of closure, or something that you might be able to take away from the experience. And the difficulty of letting that experience sort of chaotically roll around a bit and see where it comes out next week or the week after may be a difficult thing to tolerate.
causes hypnotherapy or possibly psychodrama. And that would be another type of experience that I would get.
So there's some question in your mind about whether or not you were hypnotized?
No, I didn't know that you were going to present anything here at all because I didn't get the brochure. But I did experience now how you experienced Erickson and I experienced it with you. To me, this was experiential in that sense that I understand Erickson better.
Is there some other particular thing for you might be interested in working on?
Possibly. I haven't experienced hypnotherapy. But I'm not going to, I would be willing to take certain...
Did you notice that when I was telling those stories, your muscle tone had changed, your respiration rate had changed, your heart rate had changed, your blood pressure had changed, and your focus of attention was quite fixed upon me?
Very much so.
That is hypnosis.
Oh, that is it. I was wondering whether that's what you were trying to present here. I had a feeling that you were actually...
So you were hypnotized then?
I wasn't?
You were, according to the evidence you just presented.
Interesting.
Yes.
I also felt that I was, that you conveyed your experience with Erickson. I was a little unclear about Whitaker, who I know he's humorous and he takes things to the absurd, and I wasn't quite certain about that, but I felt that now you were also conveying the experience of being with Wilfred Dion. I was present at the Franz Alexander lecture. I think that's what you were referring to when you heard Dion speak, and one of the eminent psychoanalysts were, expounding on Dion, and Dion said, perhaps you can tell me what I'm, however he spoke about the other people knew better what he was going to say than what he was going to say. It was really absurd, again. But with Dion, there's always no closure, or there was no closure. It was always sort of left open, and you go away feeling challenged. And I felt that you were giving us that feeling, to sort of fill in. And I didn't know what you were going to do today, so I didn't feel any kind of, that I had any expectation.
I guess you're trying to show me how it is to feel challenged and excited and enthused and perked up.
I like to think about things that go away, trying to figure things out. And I didn't know that was hypnosis either.
Yeah.
I have a question. Does it take long for a type A personality to learn how to hypnotize oneself or whatever? I'm not sure that I am that type of personality, but since you said you are...
Well, Erickson, the first day, he's told these stories for 4.5 hours. And the second day, I thought he was a magician. And I said, can you hypnotize me again, Dr. Erickson? He says, by the very fact you've asked the question, shows that you can go into trance as deeply as you wish, for however long you wish, and come out whenever you wish. And my conscious mind thought, how the hell am I going to do that? I don't called the patient about it. He says, well, something's missing. Why don't you give it to me? He says, well, I don't really know how to do it. He says, go ahead, I trust you. I'll take a chance. So I told my first story that way. When I told the story, I went into the trance state myself. Practice. One time after another. It'll happen. So, particular time and way. Anybody have anything specific they'd like to work on or like work in an analytics sort of way with?
Your story about how you developed yourself, somehow I got lost when you say now you work in an analytics sort of way, and it sounds like Dion gave you the most kind of direction in how you're dealing with your patients today. But I didn't quite understand how he did that.
That's the
And
part.
I'd be interested.
That's the part I would like to demonstrate. That's the part I would like to do now, so you have a better sense of what I do with it.
Mm-hmm.
Would you like to work on anything?
On any problem?
Anything that concerns you in your life? Or?
I'm trying to think and I'm blocked. If somebody else it comes easier, I will take time.
Well, it's the sort of thing that wouldn't come easy. And I wonder about the anxiety which leaves you blocking your mind out.
The thing that I'm thinking about is that I'm in such a good place in my life right now that I have block problems, and that's a good place to be, and I'm not sure I want
The possible assessment of me is that I might screw it up for you.
There's
it.
always.
No, I'm not even saying that. I'm saying that I've gotten out of the habit of looking at my own problems. And so it takes me.
I can live with that. If there is anything you want, the opportunity is open.
It seems like when the challenge that seems to be come up, Ellen talked about it, and Jen has talked about it, I'm feeling it really hard. It's like there's an attraction to the notion of the unconscious, to the notion of having no boundaries, having no set kind of way to do it or instructions, which has always been an issue for me, looking for the right way to do it. And it's like, I want to go there, and then there's this terrible backpedaling inside, like a panic.
Of course, one would have to know the right way to do it to know how to not do it.
That's true.
And there is a question, I guess, for you of how does one get to that place? In yourself, in your own work,
Yeah.
in your own...
It's in the sense of just having confidence enough to go with something that wasn't written on a piece of paper or your supervisor didn't tell you. And I know, I'm making a big thing of it. I know I work fairly intuitively when I work, because I have good sessions, I have bad sessions. I get scared. And when I get scared, I go run and find a book. I'll read a few sentences and I feel better. Or go ask a question and get back on the track. But somehow contemplating it feels scary. I saw a session, I saw a videotape of Erickson work once, and it was fascinating, and it seemed scary to me to have that, and totally incomprehensible as to what he was doing. And I was in a hypnotherapy workshop, and was hypnotized other people.
Well, is your experience here today incomprehensible?
No,
Well, what sort of thoughts or feelings has this kind of non-experience created evoked in you?
just that, what I started to talk about. There's like a little person inside me going, wait, no, I don't want to go. It's that kind of feeling, attraction, repulsion kind of.
So maybe you're at the wrong workshop or the wrong place. The little part inside you says, no, wait, hold up. Showed up at the wrong workshop.
I don't even think so.
What's happening now?
That's scary to think about.
Well, there's no charge, no.
Oh, I'm not worried. What's scary is wait a second. I thought I knew my own mind. I wanted to come here today. You're welcome. I've been reading your book for the last week.
I like you too.
Yeah. I don't think my issue is whether I got anything out of this workshop or not. And I'm not really sure what, now that we're into it, I'm not really sure what I'm asking. Maybe nothing.
What can you teach me?
It's funny, just got back from the desert and I feel like all I know about is saguaro cactus and things like that. It really seems uppermost in my mind. I don't know.
Well, I'm a fanatic about how to do therapy, so maybe you can tell me a way that you can put this cactus into a therapeutic context and teach me that. So you've enjoyed reading my book, but this would help me enjoy knowing what you're about.
That's interesting. I brought up the saguaro cactus. It's a lesson in survival. They take for a saguaro seed to catch, to really grow, takes something like about 10 years to get past that stage. They grow pretty incredibly slowly and in constant danger.
Well, so you showed up at the right workshop, Therapy in the Line of Fire.
Right?
Now, how many years?
Is it going to take for me
No,
to
how
grow?
many have you put in? How many you got left? You said 10, so.
Oh, well. I've put in about 5.
Well, so you're halfway there.
Yeah, when I get there.
Well, it sounds like you're halfway there. I don't understand you may get there. It sounds like you're halfway already.
Well, if we're going to keep with the metaphor of the cactus, I mean, halfway is only halfway. There's a lot of little animals out there who want to eat saguaro cactus. Carry them away. They never make it.
Don't you have thorns? Or don't those cactus have thorns? Yeah, the little
Little guy?
yeah.
This is fun. Is this analytic?
It's a combination of two kinds of things. One is sort of a free-thinking, no-boundary way to confront evidence as it's presented. And another is to take the emotional experience you put out and make the kind of interpretation that would put it back into you. So I can contain it, whatever frightens you. You said you were frightened, so okay, so I have to deal with your fright. So it's put out to me, and if I get frightened by your fright, then we're both gone. But if I can contain your fright and keep my mind clear with whatever emotional stuff you put out, make the interpretation back to you in a way that I'm showing you I can contain it. Okay, so whatever your madness is, you haven't blown me out of the room. I'm here, I'm with you. That makes it safe for you in terms of doing the job that your parents could not do at that point for whatever shortcomings they had, or you didn't pick up from them or somehow or other. And if it's a characterological problem and it happens over and over and over, that's where the 4 days a week come in.
That's where what? I lost you.
The
4 days.
4 days a week.
Yeah.
The intensity of that,
Oh.
for example, the intensity of this experience, of the anxiety, of the not being sure that she's on the right track when she's half there already, would intensify with the number of the sessions. The emotional experience would intensify, and then the task becomes developing the discipline to keep your mind on the straight in the midst of that emotional line of fire. And when I say keep your mind on straight, that has two ramifications. With some people, you take it step by step. With other people, you make the kind of interpretations that just put them in chaos one time after the other, because they come in with such a solid, set mindset that if you stay with that, you can't get any life force. Now, besides, what I learned from being on Erickson or Whitaker, the subtitle of the book is The Existential Moment. What my talent is knowing where that life force is and how to get to it. Like when you said something, you said, well, I think I'm halfway there. It wasn't so much the content that made me turn that around, but there was a slight decrease in your affect, your eyes got a little duller, and your face got a little paler, and I had a slight nausea in my stomach. So the thought was, she's murdering herself off by not owning what she has already done. So how do I put that growth you've already had, or our experiences, back into you to connect with that life force in the moment? Now it's the sustaining of that life force consistently that a person learns how to develop the tools to do for themselves outside of the analysis.
Is that a complicated way of saying supporting the strengths?
I don't know. Perhaps you could expand on what you mean by supporting the
in the sense of dealing, what I do in therapy a lot is supporting their inner knowledge of what has worked for them and what hasn't in the past.
Are you sure you're ready for me now?
Yeah, I think I am. I don't know.
What made you change your mind?
I think I was thinking as if a different context of problem, a personal problem in my life. When you said problem, that's
changed your mind based on the experience you've seen here, or?
You mean just now?
Yeah.
I was entering into a question that I had about what you were saying. I was putting it into my own context, what you were saying in an analytic context.
I'm here, so I know that from my own experience, but I'm wondering why you would tell me something that I'm already present for.
You confused me.
How's that for you?
You can. I'm okay with it. How about you?
Well, you see, you sound like on the one hand you're challenging me, while on the other hand your mind is going out in space somewhere. Like you look like you're retired. Sort of this kind of retired.
What I really thought I was trying to do is to understand better what you said and put it into my own context. So I was checking with you, and now you've confused me.
Yeah, I mean, seeing that goal is totally hopeless from the experience you've had here. The question now is, what the hell to make of the whole thing for you? I mean, because based on what you said you wanted and what you did, it's turned out totally chaotically.
Well, I'm not responsible for that.
Well, I wasn't accusing you of anything. I'm just sort of saying that seems to be what's going on. I'm not saying you're a bad character or anything.
I'm
What, do you
accusing
think
you.
you
I'm accusing you.
Oh, so you think I'm a troublemaker?
Whatever.
Even worse, I enjoy it.
Right on.
See, but I would suggest that this challenge and this accusation of me really shows me more about how it is to be in your skin. That in fact, it may be somewhat frightening for the challenge of your own growth to come to you, because in fact you would feel accused. So as you indicated earlier, the first thing you said, the first piece of evidence, was that you had stopped your growth because you felt okay now. And as if somehow you would continue that, you might feel not okay. So that, and then you show me the accuser by accusing me, so I can only assume that you feel at some level, in some way, were you to pursue your own growth, you would feel accused, or the finger pointed at you in some way.
Well, I thought I was telling you that I didn't have any particular problem that I wanted to bring up in my personal life, because that's what I heard you asking me.
See, but you have brought one up. You brought up the problem of whether or not you can continue your growth, or in fact that you might feel accused if you did, and you'd have to stop there. And I'm willing to stop right here on that, because I don't think we could go any further with it.
I have a question regarding something.
Yes.
Can I just say that I think we should aim at being finished by 5 to 1, because the place has to be locked up at 1 o'clock. Someone will be here then. We need to get the desks back into place and clean up the kitchen before we lock up.
Yes.
I'm somewhat familiar with Erickson and Jay Haley, who worked with him for a long time.
Mm-hmm.
And recently I attended a workshop with Jay Haley.
Mm-hmm.
And he is so different from what he used to be. What exactly, when did they part so much? Do you have any idea about that?
Well, I think Jay Haley's got a good eye. He's very descriptive. Within his own schizoid frame of reference, he's very clear.
Mm-hmm.
He doesn't seem to go below the head into the body.
Yeah.
He deals straight with problems. He does what he does very effectively, and he has no sense to flow with his own unconscious that way. Were you getting more of a sense of what you wanted? Good. The other thing I do is I'm interested in, if anybody's interested in starting a supervision group, and I do supervision over the phone with some people, like they call me and I charge them by the minute when they're stuck with cases. If anybody has an interest in that, I like doing it. Any other comments? I got 2 minutes left.
You have some cards?
Yes, I do. And I just love being here. I had a good time.
Thank you.
Yeah.
Thank you.